Let's bring the Senate Health and Human Services Committee to order. And it is 3:04. Apologize for starting late, but we do have an hour. And we're going to start off with a prayer. Senator Kim is number 3.
Okay. Let us pray. Gracious God, we give you thanks for this day. On this day in which many people across the world remember that we are created in your image and that to you we shall return. We lift that up and ask that you would help us to provide health and well-being to all of your people. We ask that you would watch over nurses and doctors and techs and all who are in the medical field. Help them to continue to do good work for one another. We pray for all who are in the health and human services field. May we love and respect each other as you love us. Amen.
Thank you, Senator Jackson. Really appreciate that here on Ash Wednesday. Last week we did 5 bills in 50 minutes. So those were not terribly controversial, but I promise that we're going to have controversial bills coming to the future. And here we are. So we're going to do 2 bills today. We're going to do 30 minutes, maybe 35 on the first bill, which is going to be what we're going to do a hearing only on SB 141. Then we're going to have SB 140, and those are going to be 30, 35 or so. And then we're going to do SB 102, which is going to have the remainder of the time. So we got the room for an hour, and that's going to be the framework that we're doing. So let's be respectful of everybody's time, and let's be respectful of people in the audience and who are testifying. And so that's sort of where we are. We don't have Capitol Police hanging outside in the halls. We've had that before, but if we have outbursts, we'll give them a ring. So I don't want them to remove you, but let's be respectful. Okay. That's all we ask. And this is much more relaxed than other places, but Senator Dixon, Chairman Dixon, you have SB 141, and you're welcome to be wherever you are comfortable with a podium or down here the witness. So that's your discretion. And in your folder is SB 141. This is going to be a hearing only. And the witness 2, the floor is yours.
Thank you, Mr. Chairman and committee members. I do have a doctor that was going to testify with me as well, if that's okay.
Yeah, absolutely. He can sit by you. You can wait, whatever you want to do.
I think he was coming up the elevator and I took the steps.
That's good. When he gets here, you can, whatever you want to do.
Thank you very much. I'll go ahead and start presenting, if that's all right, just to keep everything within a timely manner.
He's making his way. Why don't you go ahead and go, and then we'll introduce him when you turn the mic over, unless you want him to start first, whatever.
No, that's great, Mr. Chairman. Thank you. Thank you, Mr. Chairman, committee members. I bring Senate Bill 141 before you. It's called the Child Protection Act. And simply what it does is it prohibits puberty blocking drugs, cross-sex hormones, gender reassignment surgeries for children under the age of 18. And that is simply what the bill does. I'll be happy to go through the bill. But, young Georgians electing for surgeries that will forever alter their physical appearance and their state of mind below the age of 18, when they can't, they can't join the army, they can't buy alcohol. There's a lot of things that they can't do before they're of age. And this is definitely one of them, in my opinion. And if you look through the bill, section 1, it goes through just fact finding and things that have happened in regards to all 3 of those matters. And if you get into section 2, one thing I know that has been brought up as far as the puberty blockers is dealing with young adults or young women, as young as 4 or 5 or 6 that may start puberty early, and that physicians use those puberty blocking drugs to slow down puberty until the child is of age. This bill would allow that. There's exceptions to this, and it is all in section 2. If you'll start at 98, line 98 through 100, it clearly states that, let's see. Perform for the purpose of attempting to alter the appearance or affirm a minor's prescription of his or her gender of sex if that appearance or perception is inconsistent with a minor's sex. And so that's the definition, the paragraph definition. Below that, it states all the prohibited actions. And then below that, starting at line 117, it lists all the exceptions.
Chairman, are you,
Yes, sir.
you proceeding on? Or we?
Oh, I'm sorry. I was letting y'all look through that. I apologize.
Okay, I'm sorry.
But no, be happy to
There was
answer any
pause there.
questions and would like to hear from the
You know,
doctor as
just
well.
like to
I
fill
saw
in
people
those
flipping
gaps,
through.
and I got you. Okay. All right. Okay. You can proceed on. All righty. So you want to introduce or,
Yes, sir.
want
Thank
you know, witness 1, witness 2, just introduce yourself, where you practice, and for the committee, and thank you for being here.
My name is Quentin Van Meter. I'm a board certified pediatric endocrinologist in practice in Georgia for the past 32 years, trained 42 years ago in pediatric endocrinology at Johns Hopkins. There is a lot of experimentation going on with infants, toddlers, and adults using hormones and surgery to try to change the physical appearance of these children back then. It was found to be harmful. Those studies were closed and left as a sad chapter at Johns Hopkins. Today, we are dealing with kids who in more increasing numbers have issues with incongruence of their gender identity and biologic sex. It is not a biologic issue. Gender is a social construct, a psychological construct. It has no biologic basis. There's plenty of literature to support that. You may hear otherwise, but one is not born in the wrong body, not born with the wrong brain. So the compassionate care for these children, which I, as a pediatric endocrinologist, provide, is to get them to appropriate counseling, to evaluate the psychological environment of the home, the extended home, to delve deeply into the emotional problems which underlie all of the issues of gender incongruence in every single patient I have seen with transgenderism. So the affirmation, if you will, socially, medically, and surgically is a push to try and experiment on children with an open-ended outcome to see whether or not they get better some 20, 30, 40, or 50 years from now. What we do know from Europe is that they are 30 years out with their experimentation, and they have seen the sad side effects of puberty blockers creating emotional havoc, increasing the mental morbidity and increasing suicides in the patient studies from England and from France and from Denmark. So we know what happens. We're not there yet in the United States, where we've just been at this for about 17 years. But what we are doing is a problem for kids. It is actually damaging them and hurting them instead of helping them. So the compassionate thing to do is what Europe has now chosen to do, which is to use only counseling and in-depth counseling for the kid themselves, and to go within the family and look at all the pathology that is there that causes this child to hang on to an ideal that by changing their sex in appearance, they will come to a new and happier place, when we know that that does not actually happen.
Thank you. Really appreciate you coming and offering your expertise. I mean, you're on the front lines, pediatric endocrinologist, you're there. Thank you so much. If what I'd like to do is that if we could have some public testimony, and then we can get some questions, and then we'll proceed on to Senate Bill 140. So 141, a lot of people have signed up and have signed up for both. So if we could, if you would, I think since we have 16 there at 141 and 7 on 140. So if you do the math, that's going to run out of our time. So if you wouldn't mind maybe just choosing which one you want to talk for, and we'll start off with Isabel Otero, and then on deck will be Jeff Graham, and then in the hole will be Jen Slipaloff. I apologize for mispronunciation. Yeah, let's do a couple minutes, and if y'all want to stay down here, that's fine. If you want to hang back there, that's fine too. The floor is yours, Ms. Otero, and your mic is on. And if you just everybody identify themselves, tell
Yes,
them
sir.
who they are. If you represent somebody, if you're a lobbyist, let us know who you represent.
Thank you. My name is Isabel Otero. I'm the Georgia Policy Director for the Southern Poverty Law Center Action Fund. I just want to point out that Chairman Dixon himself presided over a committee hearing last week where we had another bill on transgender youth. And he said we would have enough time next time the bill came up to committee. There were more than 24 parents and youth who were interested in speaking. This bill got on the agenda 1 hour before this hearing. And I know there are a lot of people that would like to speak to it. Bottom line, our main.
Let me just clarify.
Yes, sir.
This is, you can stop the clock. This is a hearing only, and you're welcome to express your public opinion. And if we have another hearing on it too, that's fine, but we're going to not vote on this one. We're going to vote on 141. So I
If
just
there
want to
is,
be clear
if
on
there is another hearing, will you all allow public testimony?
Here's what we're going to do is that if you want to submit something to us in person, we'll certainly take that. But
Yeah, we're
getting a little bit close to
I understand.
crossover, and
We have a lot
right
of
about
parents that have reached out to us and to other organizations. I just wanted to point
Listen,
that
I know
out.
you're a lawyer. I'm a physician. I don't do well when I talk to lawyers. Y'all always.
No, I'm not one of the lawyers. I'm their policy
Okay.
person. But
All right,
I
maybe
do work for a lot of lawyers.
I got you. Thank you.
Yep. So,
You're on
you
the
know,
clock.
thank you. So bottom line, I am truly disappointed by a bill like this. This is government overreach in a way that is truly unprecedented. And every time we've seen a bill like this in any one of the other states that we work in, such as Alabama, Florida, there's an immediate legal action that comes through, because this is just on its face unconstitutional, right? People have equal protection under the law. This does not allow parents to make medical decisions for their children. These are private decisions that need to happen between parents and their medical professionals, not between parents, the government, and medical professionals. And it's very important that you all hear from parents today. It's very important that you all understand that this is real lives are on the line here. In Arkansas, another state that we track, when a bill like this was passed, there was a spike in suicide attempts from transgender youth. This is a this has real consequences that I'm not sure are being considered when we continue to attack young trans children in this way. So with that, I know there's a lot of folks that will speak after me. I just wanted to say this bill is unconstitutional. Please listen to the parents. Please understand that this is government overreach and we need to do better. Thank you.
Thank you, Ms. Otero. Got Jeff Graham, then Jen Slipaloff, and then Claire's next sectioner in the hole. Mr. Graham.
Thank you, Mr. Chair, members of the committee. I am here to oppose Senate Bill 141. My name is Jeff Graham. I'm the Executive Director of Georgia Equality. We are a membership organization of over 90,000 individuals throughout the state. Our mission is to advance fairness, safety, and opportunity for the estimated 425,000 adults and 60,000 youth who identify as lesbian, gay, bisexual, transgender, and queer. We also stand in solidarity with the millions of parents, families, friends, care deeply about the well-being of LGBTQ Georgians. We're very concerned about this attack on transgender youth, their parents, and their healthcare providers. This kind of restriction threatens the medical community as a whole by putting extremist politics before expert recommendations. Organizations such as the American Medical Association, the American Academy of Pediatrics, the American Psychological Association, the American Association of Clinical Endocrinology, and other expert groups such as the World Professional Association of Transgender Health already have robust guidelines for age-appropriate care for transgender people. Furthermore, even this discussion of this topic causes stress among families and children. These debates distract from the important work that this body has done and continues to do to address the mental health needs of Georgians of all ages. In a brand new Trevor Project poll, they are one of the top suicide prevention organizations in the country when it comes to youth suicide prevention. They released a poll in January of this year that stated that 71% of LGBTQ youth, including 86% of transgender and non-binary youth, say state laws restricting the rights of LGBTQ young people have negatively impacted their mental health. A majority of those trans youth, 55%, said it impacted their mental health very negatively. Opposing these harmful pieces of legislation is a necessary component of suicide prevention. I hope that this committee will reject any restrictions on the standards of care that have been proven
Thank you,
safe and effective.
Mr.
Thank you
Graham.
for your time.
Really appreciate that. Jen Slipaloff. I apologize. How do you pronounce? All righty. And we got Claire Sexton Snyder and Carl Nicholas. I got that one, I think, in the hole.
I am the proud and protective mom of a trans daughter. She has been living as her authentic self for a decade. For a decade, she has been insistent, persistent, and consistent in telling us who she is. This is not a whimsical idea. This is not an experiment. I will say that she does not have the emotional problems that Dr. Van Meter mentioned earlier. He was also incorrect. Johns Hopkins does have a gender clinic that does serve trans youth. I know that most of you don't understand the experience of trans youth, but that doesn't mean that you should legislate against it. In fact, it's your lack of understanding that should be the thing keeping you from legislating it at all. If a family and their physician are comfortable administering treatment, why on earth does the state need to be involved? Why don't you trust parents of families like mine? In fact, doesn't ALEC, the American Legislative Exchange Council, who I know many of you are familiar with, have a model policy around parents' rights that states the liberty interest of a parent in the nurture, education, care, custody, and control of the parent's child is a fundamental right recognized by the United States Constitution. But yet the sponsors of this bill insist on being in the doctor's office with me. It is the height of hubris to think you know better than me and my daughter's doctor about what she needs. Furthermore, this bill is one more example of a way that we are consistently telling our trans children that they don't belong. And frankly, I'm sick of members of this assembly making my daughter feel less than. When my daughter first transitioned at school, my biggest fear was that she would be bullied by her classmates. I'm happy to report she has never been bullied by her classmates. That's not to say she doesn't have bullies. She does. They're in this room right now. They sponsored this bill, and they're the ones that are going to vote for it. Under the guise of this bill, you're saying you want to protect children. This doesn't protect my daughter. It is handcuffing us to your arbitrary directives. This is taking away her identity, her privacy. How dare you? My daughter is happy, healthy, and thriving. And hear me when I say this, she doesn't want and she doesn't need your protection. She wants you to leave her alone.
Thank you. We really appreciate that. And Claire Sexton Snyder. Sneck Snyder, Carl Nicholas, and Elizabeth Wagner. Thank you.
Good afternoon. My name's Claire Scheck-Snyder, and I've lived in DeKalb County for 35 years, and I am vehemently opposed to SB 140. My son Sam transitioned when he was 12 years old. I never saw it coming. I was completely caught off guard. My family had been through some real challenges in the previous years. In 2015, I was diagnosed with breast cancer and had a double mastectomy. My parents and sister came to live with us to care for me and ensure my husband would continue working. My parents went home after a month, and no sooner than they had gotten home than my mother wound up in the hospital and was diagnosed with brain cancer. She came to live with us again to get treatment at Piedmont Hospital from the same doctors who treated me. My mom died in November 2016, and my son Sam had known for a while that he wanted to transition, but he didn't approach me with it until he felt like I had my feet under me, with all that we'd been through. He's a deeply thoughtful human being. Sam was a happy kid and an okay student before he transitioned, but he truly blossomed after he leaned into who he really was. It was incredible to see his confidence. He went on testosterone after meetings with doctors and psychologists. And in 2020, during COVID, at age 15, he got a double mastectomy. It was mind-blowing that I had only had a double mastectomy 5 years before. It was extremely important for him. His father and I approved wholeheartedly, and we want our son to know that we love him no matter what, even if he changed his mind later, which I believe he will never. He knows that we loved and supported him and heard him in his needs at age 12 and at age 15 and now. My son is a freshman in college now. He's a published author. He is in the honors college at university, and he has excellent grades, and he even has a part-time job at Dairy Queen. I know many of you are against allowing these surgeries for minors, and it's probably because,
Yes, thank you so much. We
Thank you.
appreciate that. Thank
please,
you.
please don't do this.
Next next person to testify is Carl Nicholas, and Elizabeth Wagner's with that, after that, and Rebecca Mitchell. Okay. Is this Mr. Nicholas? Do you want to, your daughter's already spoken. Do you want to give your time to somebody else who may not get it otherwise?
I would prefer to be heard.
Okay. You signed
7
up.
years
You
ago,
got it.
my granddaughter became my grandson. That makes him a trans. The T in that alphabet soup of LGBTQ that embraces lifestyles that we've decided to disapprove of. Sam went through a year in counseling before taking up the final step, and now he's gone from a good student to an excellent student, and from high school to Western Washington University, a place he finds more accommodating than Decatur, Georgia. I know that Sam was lucky to be born in this century, when medical science could provide relief for his condition. I also know that many of the folks that were critical of Sam's decision are probably enjoying the results of other treatments made possible in this century, like breast enlargements or pills to shore up a failing sex life. Things they might be too shy to discuss, but which they find less objectionable than sex change. To those folks, I say, the ways that trans people, or all LGBTQ folks, use to cope with the life that they have are none of your business. Butt out.
Appreciate that. We're getting close to the time limit to be respectful of the next bill also. So if any of the others, Elizabeth Wagner, Rebecca Mitchell, Jen Hadley, Ben Ackerley, those are parents, would like to submit their testimony, we'll be happy to take those. And I do want to give a couple of others some time to speak also. So
I'd like to
y'all's
provide my
decision.
statement.
Okay.
My name is Elizabeth Wagner. I live in Berkeley Lake, Georgia. I am the daughter of a retired Marine colonel, one who was awarded the Silver Star and served his country with honor for almost 30 years. It is because of him that I hold dear the values of service, resilience, honor, truth, and discipline. I carry his warrior DNA, and I'm here today to speak out against this legislation and efforts to restrict my right to make the best decision for my child with the support of our medical team. I ask that you set aside personal bias and legislate based on fact. The facts do not support this legislation, despite what you have heard from others. I ask that you listen to the experts and the families who are knowledgeable on this issue and directly affected by your decisions today. And if you need a Bible verse for inspiration, let me paraphrase. Love the Lord your God with your whole heart, mind, and strength. Love your neighbor as well. Gender affirming care is not waking up and going to your local CVS and buying modifying hormones. Gender affirming care is a community of discerning medical professionals, therapists, endocrinologists to surgeons who provide life-saving services. It is a personal, private matter. Where's the outrage over the growth of gastric bypass surgery for children as young as 12, an operation that is irreversible in most cases? In a recent video, a member of this committee expressed his excitement over introducing an anti-trans bill because our children need protection from a lifetime of regret. Expressing excitement over legislation that will bring so much pain to youth who already face a higher risk of suicide is horrifying. My child did not choose to be in this situation, to be treated as less than by society, to be misunderstood and judged because who he is makes you uncomfortable. And your version of Christianity tells you it is wrong. All youth deserve the blessings of comfort, peace, and freedom. Blessed are they that suffer persecution for justice sake, for theirs is the kingdom of heaven. I am who I am today because I have a trans child.
Thank you very much. We
Thank you.
really appreciate that. So I'm going to ask Mr. Frank Cade signed up for both bills, Senate Bill 141 and Senate Bill 140. If he wants to wait or he wants to speak now.
I'll speak now.
Okay.
Hi, committee members. You've heard from a lot of parents so far today. I really appreciate their testimony. I wanted you to hear from a trans individual as well, someone who was a trans child growing up and is now a transgender adult. I am a community advocate, a nonprofit professional. I've been involved in nonprofit and advocacy for 10 years. I'm also a non-binary trans man. I speak from personal experience when I tell you that lack of access to gender affirming care increases suicide risk for transgender youth. It is a risk to our lives. In my adolescence, I received treatment for suicidality multiple times. I never received treatment for my gender dysphoria. It was only that as an adult, I was able to access the care that I needed to begin to repair the damage of years done to my mental health without receiving the appropriate medical treatment that I needed. Your decisions here today affect the lives of our young people. The risk of regret from these surgeries and these procedures is extremely low. A recent study showed that only 2.5% of youth decide to detransition in adulthood. However, the risk of suicide for not receiving care is extremely high. I ask you to consider that risk, the risk to life and wellness that cannot be reversed if these procedures and these medically appropriate treatments are banned as you're considering this bill, and I ask you to vote no. Thank you.
Thank you, Frank and Kate. And then we have Cole Muzio and then Mike Griffin's on deck. Mr. Muzio.
All right, thank you. I'm going to try to go quickly. First of all, I want to thank the chairman for the dialogue and continuing to have the conversation about this bill. I'm here to support. I'm Cole Muzio. I run Frontline Policy Council and Frontline Policy Action. We're here to support SB 141. This is about loving our neighbor. This is about compassion. This is about science. And this is about what is in the best interest of these kids. Study out in Sweden, which Europe seems to be, as the doctor pointed out, far ahead of us on this in terms of what they've done and are now rolling back what they've put in place over the years. Study in Sweden showed that suicide rates among children that have been transitioned was 20 times higher than normal. That's devastating. The horror stories are mounting as we look at these cases all across the country of children that have had healthy body parts removed, that have had puberty blockers, that have had hormone treatments. And it's time that we step up and protect these kids. SB 141 is a bill that we're grateful to work on with Senator Clint Dixon. We appreciate Cardin Summers and SB 140 as well. This bill includes stronger definitions in our view, and we encourage the committee to look at those. It also includes protections against puberty blockers, which we encourage the committee to look at, as well as some other things. Our goal is to make sure, regardless of whatever bill number, that we pass legislation today and in this chamber before we gavel out on sine die, that protects children and can be upheld. And I'm encouraging the committee to take the first step in doing so today. Thanks.
Thank you, Mr. Muzio. And you Mike Griffin with Georgia Baptist. Mr. Griffin, you actually signed up for both and you want to, speak now or
Yes, sir. I can go ahead.
speak now, forever hold your
Yes,
peace.
sir.
There we go.
I hear you. Thank you, Mr. Chairman, committee. My name is Mike Griffin. I'm the Public Affairs Representative with the Georgia Baptist Mission Board. And this is my 16th year down here and been dealing with issues, and some of these even related to this. The Georgia Baptist Mission Board, which represents among Southern Baptists about 1.5 million Georgians, in 2019 passed a resolution on gender dysphoria and its treatment. Have copies of this. I'll be glad to give the committee that we have weighed in on this. We believe that there's a legal issue here regarding the age of consent. This type of medical treatment on a person's body should not be allowed till they're 18 years of age. We already see this in areas, legal areas regarding alcohol, smoking, tattoos, all those types of things. Minors and even older youth are not allowed to engage in such activities, even if their parents consent, because it has been detrimental as a matter of public health and safety that young people must be protected against the consequences of dangerous decisions. So how much more would this be true in life-altering decisions that we see here related to this legislation? I think it's a science issue. There's no doubt that human beings are born male and female, and if they're researched and found 400 years ago, years from now, the DNA that they were found with when they were born is going to still be the same DNA. And then it's a moral issue. I believe it's some long-term effects here that need to be made after children are over 18, and in many ways can be seen as child abuse upon them because of the things that happen to them that they would otherwise, and some have chosen to wish they could have reversed it, but it was too late. We love the LGBT community. I know Jeff here, we've even talked about this. No, I'm serious. I've been through this a long time. I've said, we could even agree on this to some extent because we certainly agree that young people are to be certain ages to make certain decisions. And there's certainly psychological care and counseling that needs to seriously be administered first and foremost in all of these things. Thank you, Mr. Chairman.
Thank you, Mr. Griffin. All right. Senator Summers, we're going to move on to Senate Bill 140. And Senator Summers, if you want to be wherever you're most comfortable, down here is good. Mr. Rawls, do you want to join him? And you want to use mic 1, and Ms. Rawls, if you want to pull that and just thank you, Ms. Summers. We're switching, just for everybody, we're switching to Senate Bill 140. Senator Summers and the committee have been working diligently on this bill, and we made changes to that. Many times when we're doing legislation that's controversial, neither side is perfectly happy with it, and that's sort of where we've come with. So I'm sure that we're going to hopefully continue to agree to disagree at times, but not be disagreeable. And Senator Summers, the floor is yours.
Thank you, Mr. Chairman, members of the committee. I'm glad everybody was here to talk about 141. So we ought to sail right through 140. But on 140, we took a different approach when 140 was drafted. And all we're simply doing in 140, and I'm going to hit the highlights here, but I want to point these out to get us started here. We're simply saying we want to wait and see approach, a do no harm approach, until a child reaches the age of 18. At that point in time, whatever that child or family decides to do, it's their business. But things that are irreversible in the younger days, they may not want to live with them once they're past 18 years old. And that's sort of the crust of the situation. That's what we're looking for. That's all we're talking about. And as you well know, this bill restricts any ability of physicians or hospitals to conduct irreversible medical procedures on children as treatments for gender dysmorphia, specifically cross hormone therapy, gender reassignment surgery, etc. And basically, it boils down to, once again, the 18 years old deal. And then section 2 of the bill says the bill prohibits licensed medical facilities, this is hospitals also, and doctors, for performing these type surgeries until the child reaches 18 years old, or unless a composite state medical board of examiners have gotten together and decided something else needs to happen, but it just can't be at random. Okay, in violation of this section, obviously is, we didn't put any kind of penalties where they'd be, taken outside and tarred and feathered and, whatever. We're going to let the medical board itself police this action. That's basically how it's designed to be done. And so hopefully that would, be enough to make sure everybody, stays on the right track. And that's, we think medical professionals need this. We think hospitals need this. And we think that, in my opinion, it has absolutely nothing to do with whether you're trans, whether you're straight, whether you're not, whether you're, this is a bill simply designed to say, let's wait and see, get them to 18 years old, or do what you want to, but till we get to that point in time, no life or no sex changes in children will take place, period.
Thank you, Senator Summers. Mr. Rollins, you want to identify yourself and if you have?
Yes, sir. I'm
anything to add?
Tom Rollins. I helped sort of get the idea of this bill going. I think the key here, I want to clarify, is that certainly we respect and understand gender dysphoria and really gender identity questions among all children. The question is not that. The question is, at what age should we permit irreversible procedures? And as Dr. Watson, as I think we've kind of looked at, and you've looked at, and a lot of other professionals that you talk with have looked at, what exactly do we mean by irreversible procedures? What procedures affect fertility for the long term? What procedures can have a lifelong effect on the individual? Certainly, it appears that cross-sex hormones and gender surgery have those irreversible effects. And given that the majority of individuals who display gender dysphoria resolve it in some way, they may resolve it in becoming accustomed to their own body and their own gender, so to speak. They may become gay or bisexual. They may find a different attraction to different kinds of folks. But the bottom line is that we're simply suggesting that until the person is 18, we should limit irreversible medical procedures on such individuals. And of course, we've also in this bill really are relying on the Composite State Board of Medical Examiners to create appropriate exceptions to those rules. I'll be happy to answer any questions you might have.
Thank you, Mr. Rawls. What I'd like to do is have some testimony, and then if y'all would stay there, and we'll circle back. Tom Biederman, and then Francesca Rule, and then we're going to have Taylor Hawkins. Thank you. If you wouldn't, again, just identify yourself, and we have a couple minutes to be respectful of everybody else, and we're running a little bit behind. Thank you. Your floor.
Chairman and members of the committee, I'm testifying. Okay.
Gotcha.
Yeah, I'm testifying in opposition to SB 140. My name is Tom Biederman, a resident of Atlanta, and as a parent, I know what it's like to lose a child to suicide because of no availability for evidence-based care. No child should be denied the care they need for a normal variation of human existence. Legislators are not always in the best position to evaluate treatment plans and stay to the current science. Every major medical and psychological association opposes legislative bans on access to affirming care, including voice modification and reduction of the Adam's apple, for example. While restrictions exist in Europe, they do not outright ban access. Please give more weight to medical providers who are actually delivering clinical care for transgender youth. I've not heard one medical provider state that they need legislators to determine which studies are valid and which ones are not. For example, studies that show 98% of patients have no regrets from a surgeries or affirming care. This does not invalidate the concerns of the other 2%, but the risks of banning care ignores the harms of not accessing such treatment, including high rates of mental health disorders and suicidality. Some say minors don't have cognitive ability to provide informed consent, yet many know what sex they are at an early age. This legislation provides surgery exemptions for intersex youth. In other words, care is not banned for one group, but only targets transgender youth for access to care. The Eighth Circuit has affirmed an equal protection violation because Arkansas's legislation discriminates against transgender minors based on sex and transgender status.
Mr. Biederman, I apologize. I think that's been 2 minutes. Our timekeeper walked out the door, but we're certainly happy to accept your testimony.
Okay.
Thank you very
I
much.
timed it. Thank you.
Francesca Rue. And I probably did not pronounce that, butchered that last name, but that was pretty close.
It's Francesca Rue.
I messed up the first name. I'm sorry.
No,
Okay.
you're good.
All right. Thank you.
All right. Hi, my name is Francesca Rue and I'm with the Georgia Youth Justice Coalition, but today I will be reading testimony from Dr. Jennifer Howard, a Clark County parent and mother of a 15-year-old child receiving what is now appropriate gender affirming care. I am the parent of a 15-year-old trans child. We live in a rural, tightly knit community in North Georgia. My child started to identify as trans in elementary school. He was a happy participant in the school community, but sometime during his elementary years, school became difficult and he became increasingly isolated from friends and family. He became depressed. They developed an eating disorder and started to self-harm. They had multiple dark periods of suicidal ideation. This was a terrifying time for our whole family. I was at a loss about how to support them. They were 11 years old. At their yearly physical appointment, I went fully prepared. I wanted to discuss all of our concerns with his pediatrician, a member of a large and prominent healthcare company. I wanted to talk about the eating disorder, about the depression, and to receive a referral from a consultation with a pediatric endocrinologist to better understand what was happening with my child and if there were safe treatment options available. Instead, my pediatrician told us that gender dysphoria was not something that children like mine can have. He said that while there is some evidence that children assigned male at birth can sometimes, but rarely identify as female, it was not possible for my child, who is assigned female at birth, to identify as another gender. I am a mother who loves her child. I'm also a medical professional and understand the risks associated with the treatments available to these children. I can fully attest to the risks of not providing trans youth affirming care. It is harmful, it is dangerous, and it is deadly. I have been able to find a pediatric endocrinologist for my trans child who is receiving the care he needs. Medical decisions like these should stay between patients, families, and doctors, not the government. Taking away our ability to have honest and fruitful conversations with healthcare providers will harm these kids. We need to allow the trained physicians to weigh in on these cases and provide appropriate care. Please, please, please don't pass Senate Bill 140. It will only promote discriminatory care and harm our children across the state. We are not asking for much, only to be left alone to make medical decisions as a family.
Thank you, Ms. Rue. I really appreciate that.
Thank you.
And Taylor Hawkins, Mr. Hawkins. And then we're going, committee, if you can sort of think about your questions, and then we're going to vote.
Thank you, Mr. Chairman and members of the committee. As I want to reiterate, Taylor Hawkins from Frontline Policy Action. Just wanted to reiterate our support for the intentions behind this. What we're discussing here are sterilizing and mutilating surgeries and treatments that are horrific in their impact on minors, and that is not something that our state should allow. They're all experimental by nature, and would strongly urge you to consider passing this not only with the language as you see it, but as has been mentioned, would strongly urge you to consider language that prohibits puberty blockers as well. And as we mentioned before, the language in 141 around making sure that there's some extra teeth in the bill to pursue institutions that may or may not have taken part in these horrific procedures. So just strongly encourage that you take a look at what's in front of you. Also wanted to mention before I'm done, a letter that you have all received from Congressman Rich McCormick, who opens as a physician in the Navy, Georgia emergency room doctor, and husband to a renowned oncologist.
It is in that, and if you don't.
Just wanted to mention that introduction. Yes, sir. If y'all would
Folders.
take a look at that, I'd appreciate it.
Thank you, Mr. Hawkins. He
Chairman.
may have gone under 2 minutes. All righty. All right, so committee, do we have any questions for Ms. Summers and Mr. Rawls? Senator, 2, 3, I'm sorry.
Thank you, Mr. Chairman. Senator Summers, I think I understand your intentions around this bill, but I'm curious about how you perceive gender dysphoria. To delay, so my understanding is that gender dysphoria is it's something that sometimes can require medical treatment. And what you are asking is if a child, if they had diabetes, you say, don't do anything about it until they're 18. That's how I hear this, and that from the testimony that I'm hearing is that there are children in the state who are suffering, who are experiencing suicidal ideations, who are experiencing all types of distress, that under the care of a physician and a therapist and all the entire care team, their medically necessary treatment.
We got it. Medically necessary. He's going to answer the question. Thank you. And I'll follow up.
I'll be brief, and I certainly wouldn't debate where you're coming from, Senator Jackson. But as you said, diabetes, you would obviously we treat diabetes and a person would die. You don't die with gender dysmorphia and let there are suicides. I mean, that has not been proven, folks, all across the board. The reality of that.
In this, let's keep it down in
That's right.
audience, number one. Number two is that this bill does provide
That's exactly
for
right.
puberty blocking agents.
Exactly.
And it does give you a mental pause relating to that. It does not
Exactly.
require, it forbids the surgery and forbids testosterone and estrogen. So to say that it does not treat,
That's right.
I think to say that would be a misrepresentation,
Exactly.
and that mental health should still be addressed, as I'm sure every parent would want. And the puberty blocking does give a mental pause for this. So that's where we are. Next question.
Mr. Chairman.
Anybody else have a question? I want to see if anybody else has a question. Anybody else have a question? Okay, it doesn't light up here, but you got your hand up and you have spoken. You're in one. All right, Senator Orrock.
Thank you, Mr. Chairman. To the author, I don't know how you can assert as truth all of these so-called findings by the General Assembly, saying that gender dysphoria on line 16 is often comorbid with other mental health and developmental conditions, including autism spectrum disorder, and that no large-scale study. I mean, when you go down there, 1.2 through 6, these things I don't think will survive the truth test, and how you can assert them in this bill and ask us to vote for it when there's no.
All right, so let me just,
demonstration of the
I'm
link
sorry to
of the-
interrupt
of the
you, but
factual link.
as you know, Senator Orrock, you've been here a little bit longer than I have,
Mhm.
but that first section is a discussion of the problem, does not go into law.
I understand that, but
Okay,
it's,
all right, and
yeah.
Senator Summers, would you like to
I would
respond?
refer to
Mr. Rawls?
Sure. I certainly appreciate Senator Orrick's questions. I will tell you that each of the statements that is in here, I have extensively researched studies on. I have a child who has autism himself. And so I'm very aware of the issues that we're dealing with here. The idea here is that unlike diabetes, gender dysphoria may resolve itself in a number of different ways as the person's executive function develops. And we know that executive function does not fully develop, the brain does not fully develop until about age 24. So of course, 18 is the age of majority. I think what we want to do is if a family feels that a child feels that he or she or they need puberty blockers, we can do that for as long as possible. We can see how their gender dysphoria either as they go through puberty and as they develop their own identity, we can see how it goes. And they may, in fact, when they hit 18, again,
it would be an adult.
puberty stopped. And
Thank you,
then
Mr. Rawls.
cross-
We got another question, Chairman Strickland.
Thank you. I have a boring lawyer question. I don't know who the right person to ask. Maybe you, Mr. Rawls. Yeah. On line 59, where we say, leading from line 58, sex reassignment surgeries, other surgical procedures that are performed for the purpose of altering primary or secondary sexual characteristics. Obviously, I think sex reassignment surgeries probably doesn't need to be defined, but what does the rest of that mean? Is there any definition for primary or secondary sexual characteristics?
So I think the chairman could probably answer that a little better than I can.
Primary primary is going to be the genitalia, and the secondary is going to be breast enhancement or breast removal, as some of the parents testified.
So obviously the purpose of this is not to outlaw circumcision or any
No, no,
other
no, no,
procedure.
no.
And that
Let's
would
clar-
not be caught up in.
No.
Yeah, let's clarify that, Senator
I
Strickland.
can't imagine that fitting in those definitions. No,
Right.
no, that's good question.
Yeah. very good.
From a lawyer. We really appreciate that. Thank you.
No, you really mean that.
No, I do. Anybody else with questions? All right. All right, so we're going to vote on this. We're going to vote on, let me make sure we're voting on the right bill, Senate Bill 140, LC 939412S. And so I'll be happy to entertain a motion. Do I have a motion? Okay, Senator Eccles made a motion to do pass. Do I have a second? I have a second. Senator Brass. Okay, all those in favor, raise your right hand. That's 9. That was 9. We're still voting Senator Setzler. We're voting, that's 10. Okay, thank you. All right, and all those not in favor, raise your right hand, like sign. It passes 10-4. Thank you very much. I know you've worked really hard on this. Appreciate working with you. Thank you.
Thank you.
Wow, that's it's 3:55 now. That lasts a little longer than 30 minutes than I thought. So and Senator Summers says it's gonna last maybe 10 or 15. So that's where we are. All right, so we're gonna try to be efficient and take up Senate Bill 102. And that's Senator Walker. Senator Walker, you can present that either at your seat, or you can present it at shift over a couple of seats, or you can go to the podium, whatever your choice, Mr. Chairman. We could just be respectful of others if people want to transition out of here, just from a time standpoint.
Thank you, Mr. Chairman. I'm on witness 1, and if it's all right with you, I'd like to invite my wing man up here.
We do, and we have a couple of people on Zoom also, and I just want to be respectful of them too.
So I have Dr. Reed from Augusta University and John Walraven, representing the CRNA.
Gotcha.
So, Mr. Chairman, I am bringing you today Senate Bill 102. And we're working off a committee sub LC 339432S. And this bill updates the CRNA statute to reflect the current delivery of anesthesia in Georgia today. This is not an expansion of scope for CRNAs. It is simply recognizing the common practice on the ground at many of our hospitals and surgical centers in Georgia today. Back in 1994, this law was updated, and the General Assembly removed that anesthesiologists, which are the MDs, provide direction and responsibility for a CRNA's work. That basically left the language in the current code to be that they are working under the direction and responsibility of a duly licensed physician. Well, the only duly licensed physician in the room, most of the time, there's a lack of anesthesiologists, especially in rural Georgia. The only duly licensed physician is the surgeon, and the surgeon is not necessarily trained, normally not trained in anesthesiology, and is busy doing the surgery and really does not want the responsibility or liability of and based on what's in the code of being directing and responsible for the actions of the CRNA. So we are, the reason I'm involved with this is I have 2 rural hospitals in my district, Taylor Regional Hospital in Dodge County, Taylor Regional's in Pulaski County, and Dodge County Hospital that brought this concern to my attention. I've also got letters from a letter from Hometown Health that represents 45 rural hospitals that is supportive of this bill. And what they're telling me is they're having trouble hiring and retaining surgeons in their hospitals because of the perceived and possible liability that the surgeon would have for an action of the CRNA based on the way the code is currently written. Also, this is part of the governor's rural healthcare workforce initiative, something the governor has talked about and feels like that we need to address. So I'm proud to bring this to you. Also, the part about CRNAs practicing nursing, that comes out of 105 years of case law that holds that when a CRNA delivers anesthesia, that the CRNA is practicing nursing and not practicing medicine. I also want to make it clear, Mr. Chairman, that CRNAs are under the Board of Nurses. That's who regulates them. They're not under the Composite Medical Board. So it's actually a very simple bill that just strikes on line 14 that or 13 and 14, such anesthesia is administered under the direction and responsibility. It replaces that with pursuant to an order by a duly licensed physician or podiatrist. Anesthesia administered by a certified registered nurse anesthetist pursuant to this code section shall be considered the practice of nursing. The letters, I think, are in your folder from the rural hospitals. And
They are.
I'll be happy to answer any questions. If I'm not able to, maybe my sidekicks can.
Do they have anything they want to say? Mr. Walraven does not. He has said it all.
I'll just introduce myself.
Yeah,
I
that'd be
won't
great.
say much for the sake of time. My name's Reed Halterman. I've been a CRNA for about 8 years now. I'm also the assistant program director of the nursing anesthesia program at Augusta University at the Level 1 Trauma Center. I practice, teach students, and we send them all through the state to get experience, see what it's like in large Level 1 trauma centers as well as small rural hospitals, and see, the full extent that they can practice. Happy to help answer any questions.
Thank you. We appreciate that. We have a couple on Zoom, probably not officially Zoom, but Mr. White, do we have them on or? Okay, who's doing that? So either Dr. Tommy Hatchett and then Dr. Robert Kaufman or either, oh, there they are. So is he able to hear me or speak?
I can hear you.
Okay, great. The floor is yours. If you identify yourself and who you represent or tell us a little about yourself, and got a couple minutes, okay?
All right, I'm Dr. Robert Kaufman. I'm speaking out and opposed to this bill, and I do this from a personal experience and a medical experience. I practiced internal medicine for 34 years at Emory Midtown. My 30-year-old nephew went for a simple endoscopy and started aspirating, and CRNA could not get him intubated. So I feel strongly that you need anesthesia oversight. I do agree that a surgeon shouldn't be oversighting a CRNA for an anesthetic type procedure. But a lot of people do it because of cost, and they don't want to spend the money on providing for an anesthesia. And I think, this was done in Atlanta, so there's not a shortage of anesthesia doctors. So I feel strongly for safety issues for our patients, for simple procedures that go well 99% of the time, but 1% when it doesn't, it's very dangerous. And I think the CRNA needs backup with an anesthesiologist.
Thank you, Dr. Kaufman. And thank you. Yes, sir.
I think he acknowledged this, but current code or current law does not require them to be under the supervision of an anesthesiologist. I mean, I know that he thinks that would be ideal, but that's not what's currently required. I just want to point that out.
Okay.
Thank you.
Yes, sir. And where are we? Dr. Tommy Hatchett, do we have? Oh, there he is. Okay. Hey, Dr. Hatchett.
How are you?
Someone may know you in this room. The floor is yours or the mic's yours.
I just want to point, I'm Thomas Hatchett Jr. So, I'm an OBGYN. I practice in Habersham County. I've been here for 30 years. I practice at Habersham County Medical Center. And during my time here, we generally have had 3 CRNAs on staff. They provide all of the anesthesia services at the hospital. So looking back over that time, we're looking at somewhere between 12 and 15,000 births and roughly the same number of surgical cases that I've done under anesthesia. And it's just performed very well. The CRNAs are credentialed through the hospital authority. And we have a collaboration that occurs before every case to review the anesthesia plan and also to conclude the procedure after the patient leaves the recovery room. So I think it's a very effective and safe way to practice anesthesia. And I'm just speaking from my experience, and I'm happy to entertain any questions if anyone has any.
Thank you, Dr. Hatchett. It's good to see you again. We're going to move on just from interest of time, and then we'll follow up with questions after everybody's over with. We have others. Hold on. Mr. Jet, Tony, and if you could make your way up, and then Bethany, Shara, and we'll see how time's going at that time.
Mr. Chairman, members of the committee, Jet Tony, representing the members of the Georgia Society of Anesthesiologists. The mission of the GSA is twofold: to provide world-class continuing medical education and to advocate for safe anesthesia and perioperative care of patients. GSA members fulfill the educational goals through volunteer leadership and participation. Meeting the advocacy mission, however, requires your help and requires your action. For the reasons expressed in testimony to follow, GSA members respectfully ask you to vote no on SB 102. Anesthesia care, as you have heard, is delivered in 3 ways under Georgia law: an anesthesiologist, a physician specializing in anesthesiology and perioperative care, administering anesthesia, or an anesthesiologist medically directing up to 4 anesthetists simultaneously, or a certified registered nurse anesthetist working under the direction and responsibility of a physician, dentist, or podiatrist. In each of those scenarios, a physician is materially involved in the care of the surgical patient. This is current Georgia law. It is protective of patients throughout the state. SB 102 incents the removal of physician participation in the continuum of anesthesia care, and that, simply put, is going backwards in healthcare policy. No progress or expansion of healthcare occurs when physicians are removed from medical treatment. Not in Atlanta, Middle Georgia, Northeast Georgia, or along the wide stretches of South Georgia and the coast. Anesthesia is serious medicine. May I present for testimony Amanda Brown, MD, a pediatric anesthesiologist who worked years in Bibb County and now at Children's Hospital of Atlanta, to speak to the science of anesthesiology and the practice of medicine.
Thank you for inviting my testimony. My name is Amanda Brown. I'm a dual board general and pediatric anesthesiologist, and I have worked in level 1 trauma center covering both adult and pediatric anesthesia, as well as now in a specialized tertiary pediatric institution. I'd like to start actually by referencing Dr. Hatchett's testimony. In that instance, you have a highly skilled team of a physician oversight of anesthesia practice, although that model is a delivery through a CRNA. So in a high volume OB environment where physicians stewards that care, they have the safe transition of patients through that obstetric environment. The anesthesia model by regular code in Georgia is team-based with physician stewardship. That model is the safest, utilized by the nation's top hospitals and currently under existing Georgia code throughout Georgia. This is because in every setting in the state, medical care is complex. Georgians carry a high disease burden with an obesity rate of 35 to 40%, a renal mortality rate that's 40% higher than the rest of the nation. Safe anesthesia care is exponentially more difficult with sicker patients. We may have testimony at odds today on several points, but every health professional in Georgia recognizes the severity of disease carried by the patients and the gravity it presents to safe anesthesia care. There appears to be some conversation about the liability of non-anesthesiologist physicians supervising CRNAs. I'd like to reframe this from the patient's point of view. Patients in a time of health crisis expect a physician to be in charge of their care. A patient expects to be a physician directing their care, the entirety of their care, not just the line being placed or the appendix being removed. Patients expect this for themselves, their spouses, and their children. Anesthesia causes not only a loss of consciousness, but an inability to protect your airway, wildly variable blood pressure changes based on age and comorbidity. At these critical moments, is it truly appropriate for some patients to have no physician to respond to that stat code? Can I continue? I'm an anesthesiologist with fellowship training in pediatrics. In one of my
You are correct. You were very close on that 2 minutes. So
Okay.
that was, you were a very time aware person,
Okay,
I'm sure.
thank you.
Thank you. Thank you very much. We're it's getting loud in the hall. Is 4:09, and I want to get the committee to ask some questions, and then we're going to vote. So I apologize to those who have not been able to testify, but that's sort of where we are. I understand you,
Mr. Chairman.
Dr. Hamilton, and
We have two physicians who rearranged their schedules.
all right, why don't we just give a real brief, I'm for or against it, and why, if we can just do that,
Yeah,
and,
try to make
yes.
I'll make it very quick. Thank you,
Yes.
Mr. Chairman. My name is Julius Hamilton. I am a practicing cardiac anesthesiologist. I am the immediate past president of the GSA, and I am the president of the largest physician-owned anesthesia group in Metro Atlanta. It's the second largest group in Georgia. I've come to ask each of you to oppose Senate Bill 102. I am troubled by what this bill removes from anesthesia care in Georgia, and that is the direction and responsibility of a physician. My practice consists of 23 physicians, 57 anesthetists, and 5 nurse practitioners. We work together in an anesthesia team as we collaborate closely with surgeons, circulating nurses, and OR techs. Teamwork
All
is
right,
foundational.
I really appreciate it, but I am beyond my time here.
Joe Sharma from Emory. I'm a chief of endocrine surgery and the current president of the Georgia chapter of the American College of Surgeons. I'm opposed to this. I'll just say, as a surgeon, I look for an appropriate partner across the drape. And if my patients need it, we have significant complications in the operating room, and without having qualified personnel across the drape, we will have significant issues in patient safety.
Thank you, Dr. Sharma. I think we have some questions too. Senator Brass for.
Thank you. Mr. Tony, this will probably be for you. So you keep saying that it's removing supervision. Can you explain exactly how it's removing supervision? Because my understanding is we're not doing anything that's not already done. We're just simply shifting responsibility and liability of the anesthesia portion of the surgery, which a general surgeon may have very little experience in. And we're simply shifting that liability from them so that they can focus on their patient, focus on the surgery, and not focus on the anesthesia portion. So you keep saying we're removing supervision, yet we're not. So please explain your point there.
Well, a plain reading of the bill strikes under the direction and responsibility of the physician. And in plain reading, that's all I can say. There is no supervisory responsibility under Senate Bill 102. Now, if Dr. Sharma if time had allowed him to speak, he would have addressed the importance of having the operating physician involved in the continuum of care for patients. So yes, Dr. Sharma is not an anesthesia expert, but he is responsible as the operating surgeon for the care of that patient. And that has served this state well for 29 years.
Thank you, Mr. Tony. Any other questions from the committee? Just for discussion, yes. Okay, number 12, Chairman.
Yeah.
Yes.
Well,
Chairman
as,
Hufstedler.
as some of you know, and some of you may not know, I'm the third leg on that stool of anesthesia. I'm an AA or physician assistant in anesthesia. So my perspective is probably going to be different than everybody here, but I can practice in any state touching Georgia except Tennessee. The other two groups, the ASA and the CRNAs, made a deal that they wouldn't ask for independence if the ASA wouldn't ask for AAs to come in. So I'm out of that state with that deal. However, I agree with them that the model 1 to 4 that they talk about is the best model, is the safest model. I work at an open heart hospital, one of 3 level 1 emergency heart hospitals in the state, and would definitely need that anesthesiologist behind me, but that's not the case in some places in rural Georgia. However, I had a bill for the AAs that came through here, which I don't think does the scope of practice. And I have a bill in committee for the other advanced practice nurses that gives them a license. And both of those went through we call it the GORC committee, the off-session committee.
Georgia
And
Occupation.
I think, yeah, you know that.
Regulatory Review Committee. I think we got it there.
I mean,
GORC, Georgia Occupational Regulatory Review Committee.
I agree with part of that bill. I've got some concerns on the others that haven't been answered. I don't know that 30 minutes is fair. It's a very complicated issue. My recommendation, and I could even make a motion that it go through that committee and get vetted out.
You're recommending, you're making a motion and it goes to GORC.
Mhm.
All right, I'm gonna do the will of the committee all the way around. Yes.
Mr. Chairman, I just recently went through the GORC process with the Georgia Forestry Association and trying to get the forestry license issue resolved and forester licensing. This is not changing the licensing of CRNAs. It's not expanding the scope of CRNAs. I don't think it applies to it's apples and oranges, I think, what he's talking about. And I don't see where this would fall under GORC.
I think Senator or Chairman Hufstedler you just went through GORC and
I had 2 bills go through GORC this off session, one for the advanced practice nurses and one for the AAs.
right. And the AAs was not an expansion of scope.
But I think it was they wanted to be licensed.
Right. And this does, if you read it there, it does take the review of a physician. So away from the CRNA.
Well, it actually is it's pursuant to an order by a duly licensed physician. I mean, so
To an order, but
a
not
physician would have to
supervision.
order it, and of course,
The-
the surgeon is still in the room, and
I'm sorry, but I think and that's the clarity. The order is yes. The supervision, no. Correct? Is that accurate?
No, Mr. Chairman, the current law does not provide for supervision.
The current law. Help me out here.
It's direction and responsibility,
Yeah.
not supervision.
Never been.
Direction.
And this-
The law has never stated.
That's, it says direction. That's correct. Direction, supervision, I'm sorry. Yeah, well, I may need the lawyer to help straighten us out on that one. I'm not sure that's been done, but, and again, and I'm not here making a case for GORC or not, and that's going to be the will of the committee. And I too, I'm a member of that committee, and when it comes to healthcare, we had at least 4, maybe 5 meetings, Chairman Huffstetler, somewhere in that area.
Mhm.
And they're very thorough from that standpoint in vetting that out. But if you made a motion, the motion is on the table. And is there a second to that motion?
He didn't make the motion.
Did you make? a
I
motion?
thought I made a motion that this bill go through that.
Go
committee
through that process. Is there a second to that motion? Okay, Senator Orack or Hodges? Senator Orack has a Hodges. All right, let's vote on that. So Senator Huffstetler's made a motion that this bill go to GORC, Georgia Occupational Regulatory Review Committee. All those in favor, raise your right hand and keep it there, please. 6, 7. Is that what you got? You didn't see. All right, raise your hands again. Everybody raise their hands again. We're voting for going to GORC. 2, 7. All right, and those opposed. 1, 2, 3, 4, 5, 6. 6. You're saying you're against it going to GORC. Okay, so that's 7 to 7. 7 to 7. Yeah, yes. I'm sorry, you're on number 10. Yes.
I would suggest, I'm not comfortable with the language of the bill, but I don't want to consign it to some purgatory in a review panel. I think the gentleman deserves an up-down vote on this.
Oh, you make a good point. It's tie, so it fails. All right, so that's where we are. Yeah, any further questions first? 'Cause that was a question. Any other questions? No other questions? The motion stands. Let me get your mic on. Number 9.
Is it?
He's gonna make a motion to do pass. You want to second it?
Just, I'd like to make a motion to pass.
Make a motion do pass and have a second on the do pass.
Brass.
A second and do pass, and we're gonna vote on this. Keep your hands up. All those in favor of do passing, and we're on LC 339432S. All those in favor. 6. Count as 6. 5, 6. 6 is the do pass. All right, all those opposed. 8. Bill does not pass. Maybe we should have gone to GORC. Okay, all right. So that's where we are. We're going to have meetings on Monday and we're going to have Wednesday at 8 a.m. Wednesday at 8 a.m. Thank you very much.